starting the first lecture of the module with the anatomy and the development of the eyeball. So, what are the topics that I will be covering in this particular lecture? So, here I will be covering the coats and the contents of the eyeball, which is essentially the basic anatomy of the eyeball. The detailed anatomy of the individual structures I will be discussing in the individual lectures or chapters. Then in this, I will be covering the ocular embryology, which is the development of the eyeball, and I will be talking about the developmental anomalies also. So let us start with the first one, that is the coats and the contents of the eyeball, which is the basic anatomy. So when we talk about the coats and contents of the eyeball, what do we mean? See, in order to study the structure of the eye, what do we have to do? We have to first create a sagittal section. That is, I create a sagittal section of the eye and then I look at the eyeball from the side. And when I do that, then I will get to see something which looks like this diagram. So, everything that is there in the wall is going to be called as the coats of the eyeball. And everything that is there inside will be called as the contents of the eyeball. So whatever is there in the wall, that is the coats of the eyeball, and whatever is there inside, that is going to be called as the contents of the eyeball, right? So see, let us see how many layers are there in the coat. So see, they have done a color coding to make things a little bit easier visually. So see, they have given 3 different colors in the wall. So there's an outer layer which is in blue, a middle layer which is in red, and the inner layer which is in yellow. And so we understand that there are like 3 coats to the eyeball. Okay, so there are 3 coats to the eyeball. So let us see what are the names, what are the different coats. So the 3 coats are, we have the outer fibrous coat, the middle vascular coat, and the inner nervous coat. Outer fibrous coat, middle vascular coat, and inner nervous coat. Now, what constitutes the outer fibrous coat? It consists of the sclera and the cornea. So, what is the sclera and what is the cornea? See, in this diagram, if you see, this front part which is transparent in the outer coat, that is your cornea. And the posterior part, that is the white part that is visible to you, this white structure, that is opaque, and that is your sclera. So see, the outer fibrous coat consists of the cornea and the sclera. Now how about the middle vascular coat? Now the middle vascular coat, if you look at it from anterior to posterior, it consists of, number 1 is the iris. So see this structure that you see here, which is the brown structure that we can see in the eye through the transparent cornea, that's our iris. If we trace this iris backwards, see, it becomes continuous with the ciliary body. So this is like your ciliary body. And if you trace this tissue further backwards, see, you can see this red layer which is sandwiched between the blue and the yellow. That is your choroid. So this means that the middle vascular coat, if you look at it from anterior to posterior, it consists of the iris, the ciliary body, and the choroid. Now how about the inner coat then? Now the inner coat is the neural tissue. And what is the neural tissue of the eye? We all know that it is the retina. And if you see this yellow layer, which is the innermost layer or the retina, it is continuing backwards as your optic nerve. So it continues backwards as the optic nerve, which is obviously, which carries this impulse from the eye to the brain. Okay, so these are the coats of the eyeball, meaning what are the layers in the wall of the eye? The outer fibrous coat, middle vascular coat, and inner nervous coat. Now this much was simple. Now we will learn a little bit in detail about each of the structures. So let's come to the outer coat. So when we look at the outer coat, see, I told you the anterior part is the cornea and it is transparent. So the anterior 1/6 of the outer coat is your cornea and it is transparent. And why? What does it do? Because it is transparent. See, we all understand that because it is transparent and it is the anteriormost structure in the eye, it must allow the transmission of light, correct? But it is not just allowing the transmission of light. These structures in the eye which are transparent also bend the light rays so that they can meet at a point on the retina. So this is called as refraction. So this cornea, this is an important refractive medium, or we should say it is the most important refractive medium in the eye. Then how about the sclera? The sclera, obviously, because it is opaque, it has no role in refraction. It is the posterior 5/6 of the outer coat and it has no role in refraction, but that doesn't mean that it's not important. It has some very important functions. So what are the important functions of the sclera? See, it protects all the intraocular contents. It gives insertion to our extraocular muscles. So the eye muscles, they are inserted into the sclera so that you can move your eye from side to side. So that is very, very important. And also it allows the transmission of the blood vessels and nerves. Now what do I mean when I say that? See, I told you that this retina, it continues posteriorly as the optic nerve. Now this optic nerve has to pass through the sclera in order to go out of the eye. So this back part or this posterior part of the sclera is modified to form a sieve-like structure which is called as your lamina cribrosa. It is called as your lamina cribrosa. So this lamina cribrosa, it is a sieve-like structure which allows the passage of the fibers of the optic nerve. So that's why, see, the transmission of the blood vessels and nerves is also an important function of the sclera. So what did we learn? It gives protection to the intraocular contents, it allows transmission of blood vessels and nerves, and it also gives insertion to our extraocular muscles, right? Now see, at the junction of the cornea and the sclera, what do we have? At the junction of the cornea and the sclera, that is called as, see this one, this is your corneoscleral junction. So what is this? This is the corneoscleral junction which is called as your limbus. And what is the importance of this limbus? The limbus is very important because it contains the ocular stem cells. And these stem cells are important because they are responsible for regeneration and repair of the ocular surface after any kind of trauma. So this limbus is very, very important to the eye and it is the corneoscleral junction. Right? So this much about our outer fibrous coat. Let's move ahead then. The middle vascular coat. So quickly to revise, the middle vascular coat consists of the iris, the ciliary body and the choroid. Now what is the iris? See this brown structure that we see through the transparent cornea, that is your iris. So this part, this is your iris. And at the center of the iris, you all know that there is an aperture which is the pupil and that is through which the light enters inside. Right? Now what is the importance of this iris? Now this iris, it controls the diameter of the pupil, which means that the pupil can be made small, it can be made big. So this pupil, it can either be constricted, see as you see in this picture, this is a constricted pupil and this is a dilated pupil. Now why this constricted pupil? This is because of a set of muscles which are called as the sphincter pupillae muscle. And the dilated pupil is because of obviously the dilator pupillae muscle. So basically this pupillary diameter can be varied. And what is the importance of this? By varying or changing the diameter of the pupil, we can regulate the amount of light that is entering into the eye. So you regulate the amount of light that enters into the eye by changing the diameter of the pupil with the help of the sphincter pupillae and dilator pupillae muscle. So that is one important function of the iris. Another thing that the iris does is that the color of the iris is an important identification feature of an individual, and also the iris pattern. We know that just like we can identify a person by his fingerprints, we can also, iris recognition is also another way for identification of the person. So eye color and identification, this is also another important function of the iris. Okay, so this is the anterior most structure in the middle vascular cord. Now we take it backwards. If you trace it backward, I told you, it becomes continuous with your ciliary body. Now this ciliary body, it looks something like this. So this is your ciliary body. The front part of the ciliary body, it has these projections, these finger-like projections, which are called as, so this part of it, this is called as your pars plicata. And you can see that these projections, they are attached to certain thread-like structures called zonules, and these zonules are helping to keep this crystalline lens in its position. So these zonules help to keep the crystalline lens in its position. And the posterior part of the ciliary body, this is called as the pars plana. For obvious reasons, you can see that it is plane. So pars plicata and pars plana, these are the two parts of the ciliary body. So see, the ciliary body gives attachment to the zonules which help to keep the lens in its position. But that's not its only function. It is also responsible for something which is called as accommodation. Now, what exactly is accommodation? Now, accommodation means that when you look at a distant object, and then when you want to change your focus to a near object, so just like we change the focus of a camera, the focus of the eye also has to change, and that is called as accommodation. And mainly this is because of the crystalline lens, and in this process it is helped by the ciliary body. So how does the ciliary body help in this process? So see, what exactly happens is, this is suppose your crystalline lens. It is attached by these zonules to your ciliary body. It is attached by the zonules to the ciliary body. Now, when you accommodate, that is when you change your focus from a distant to a near object, then this ciliary body contracts. And when the ciliary body contracts, there is an opposite effect on the zonules, and the zonules will relax. Okay, so see, the steps are, the ciliary body is contracting. So the ciliary body contracts. And when the ciliary body contracts, the zonules, they relax. And when the zonules relax, see, this lens is a biconvex structure like this. Above and below, it is pulled by the zonules. So if the zonular pull becomes loose, then obviously there is going to be a change in the curvature of this lens. It is going to become more curved. So there is an increase in the curvature of the lens, and this helps in accommodation. So essentially it is the lens which is responsible for this accommodation, but it is being assisted by this contraction of the ciliary body and eventually the relaxation of the zonules. So see, apart from holding the lens in position, the ciliary body is also helping in accommodation. Now, what else does it do? It helps in the formation of aqueous humor. So what is this aqueous humor? This aqueous humor is a watery fluid which fills the anterior segment or the anterior part of the eye. So this front part of the eyeball, this is filled with a watery fluid which is called as aqueous humor, and that aqueous humor is also produced by the ciliary body. So essentially, see, this is how this aqueous humor is produced. It is produced like this. It is produced like this from the ciliary body, then it comes through the pupil, and then it comes to this anterior chamber. So this production of aqueous humor is also a function of the ciliary body. So what did we learn then? What are the functions of the ciliary body? Gives attachment to the zonules, which helps to keep the lens in position. It helps in accommodation, and it also helps in the formation of aqueous humor. Okay, so these are the functions of your ciliary body. Now, how about the choroid? Now see, the choroid, this is this red structure which is sandwiched between the outer and the inner fibrous and inner nervous cord, and it is the most important vascular structure of the eyeball. So what does it do? It obviously gives blood supply, which means that it provides nutrition. It provides nutrition, and at the same time it is also responsible for the removal of toxins, because it is the main vascular structure. It provides nutrition and it also helps in the removal of toxins. Correct? So this is our middle vascular cord. So we learned what are the functions of the iris, what are the functions of your ciliary body, and also the choroid. Now let's come to the innermost cord, which you all have learned by now that it is the retina. It is the neural tissue of the eye. And what do you think it does? We all know that this neural tissue is responsible for it receives the light impulse, and then it is responsible for neural perception. It receives the light, converts it into an impulse, and this is then transmitted to the brain via the optic nerve. So this neural perception, this is the function of the inner nervous cord. We will be learning the anatomy of the retina in detail in the chapter on retina. Okay, so this is essentially what are the structures in the walls of the eye, which we call as the coats of the eyeball. Now we have to move on to what are the contents of the eyeball, which essentially means that what are the structures which are inside the eye. So once again, if we look at this picture, so what do you see? What are the structures inside? You can obviously see this. This is your crystalline lens. This crystalline lens is dividing the eye into two parts, this front part and this back part. So this front part, this is called as your anterior segment. This is your anterior segment, and the back part, this is obviously, common sense says that this is called as your posterior segment. Now this anterior segment is filled with a watery fluid which is called as aqueous humor, and the posterior segment is filled with a gel which is called as vitreous humor. So these three things are making up the contents of the eyeball. So we have the crystalline lens, we have the aqueous humor and the vitreous humor. Now let us look at these also in a little bit detail. So see, you can all make out from the picture itself that the lens is a biconvex structure and it is suspended by the ciliary zonules. It divides the eye, as I explained, into anterior and posterior segments. Now what does it do? It is again transparent. So it acts as a refractive medium just like the cornea. So it's very important for refraction. But it also helps in this process of focusing or accommodation, which we just learned, by changing its curvature. So when you try to change your focus from a distant to a near object, then with the help of the contraction of the ciliary body, the curvature of the lens changes, and that is what helps you to focus at a near object, and that is called as accommodation. So then what are the functions of the lens? Number one, it acts as a refractive medium. Number two, it helps in accommodation. And it divides the eyeball into two parts, the anterior segment and the posterior segment. Okay, so now as I told you, the anterior segment is filled with a watery fluid which is called as your aqueous humor. Now, who produces the aqueous humor? We just learned it is produced by the ciliary body. It is produced by the ciliary body and it is drained out mainly through the angle of the anterior chamber. So what is exactly the angle of the anterior chamber? Let me go back to that picture which we had seen. So see, this aqueous humor, it is draining out after being produced from the ciliary body. It is passing through the pupil, coming in front, and then ultimately draining out through this wedge between the iris, between the cornea and the iris. So this space between the cornea and the iris, that is called as the angle of the anterior chamber, and that is where the aqueous humor drains out. Okay, so this aqueous humor is produced from the ciliary body and it drains out through the angle of the anterior chamber. Now what do you think will be its function? Common sense says that if the cornea and the lens are helping in refraction and the light has to pass from the cornea to the lens, the aqueous humor which lies in between also has to be transparent. So this aqueous humor is also transparent and it acts as a refractive medium. So it acts as a refractive medium, right? Next, it maintains the intraocular pressure. So this aqueous humor, this is the only dynamic component of the eyeball, meaning it is the one which is being constantly produced and constantly it is being drained out. So it is the only dynamic component of the eyeball. So that is why the rate of production of the aqueous humor has to be equal to the rate of drainage, and this helps to maintain the intraocular pressure. And if there is any obstruction in the outflow of aqueous humor, it results in increased intraocular pressure, which will eventually lead to glaucoma. So essentially we understand that the maintenance of IOP is a function of the aqueous humor. And another important function of the aqueous humor is that it provides nutrition to two important structures, mainly the cornea and the lens. So we know that these are avascular, they don't have any individual blood supply, so their nutrition comes from the aqueous humor. So then what are the functions of the aqueous humor? What did we learn? So it has three important functions. It acts as a refractive medium, it helps to maintain the intraocular pressure, and number three, it is also responsible for providing nutrition to the cornea and the lens. Right? So this is the watery fluid that is filling what? It is filling the anterior segment or the front part of the eye. So what about the posterior segment, that is the back part? It is filled with vitreous humor. Now what is essentially the difference between aqueous and vitreous? The aqueous, I told you, is a fluid, whereas the vitreous is a gel. The vitreous humor is a gel. Once again, see, if the light has to come through the cornea, then through the aqueous, then through the lens, and ultimately reach this retina, then this vitreous also has to be transparent. So this also acts as a refractive medium. So essentially, which are the refractive media of the eye? Which are the structures which are helping in the process of refraction? The cornea, the aqueous humor, the lens, and the vitreous humor. So these are the refractive media of the eye: the cornea, the aqueous humor, the lens, and the vitreous humor. Now what else does the vitreous do then? You can understand, see, it is occupying the maximum volume inside the eyeball. So it is responsible for maintaining the shape of the eye and also responsible for maintaining the intraocular pressure. So the shape and contour of the eyeball and the IOP are also maintained by the vitreous. Essentially, it is a refractive medium. These are the other functions. Okay, so this is about the coats and the contents of the eyeball, which is very important to understand the structures in detail, which we'll be covering in the individual chapters. This is just to give you an idea about the basic or the overall structure of the eye. So that's why we looked at the coverings, which are the coats, and the contents, which are the structures inside. Okay, so this is about our basic anatomy. I hope you have understood this. Now I'll just move forward and go to another topic which is not very commonly discussed. We have not had very detailed questions from this, but at the same time I feel that this is something which you must not ignore. You don't need to know it in meticulous detail, but basics of development and developmental anomalies, I think it is good if you know. So first of all, the first thing we need to know about the ocular embryology or the development of the eyeball is that the eyeball is developed from 4 germ layers. So what are the 4 germ layers? See, the 4 germ layers are neuroectoderm, surface ectoderm, mesoderm, and the neural crest cells. So neuroectoderm, surface ectoderm, mesoderm, and neural crest cells. Okay, so these are the 4 germ layers from which the eyeball, the structures of the eye are formed. Now, what are the questions which have come or which are likely to come from here? Usually what we get questions like, which of these structures originates from neuroectoderm, or which of these structures originates from mesoderm, like that. So essentially we have to memorize this, but just to make the process of memorizing a little easier, I will just explain this process of development to you. So see, in the development of the eye, what happens is that from the developing forebrain, from the developing forebrain, 2 small projections come out from either side. These are called as the optic stalk. So essentially, see, this optic stalk is a neuroectodermal tissue. This essentially starts the development. So this optic stalk, which is a neuroectodermal tissue, it starts the development of the eyeball. Now gradually, this optic stalk, it changes its shape. So I am just drawing this optic stalk of one side. It changes its shape and becomes a little bit bulbous like this, and then we call it as the optic vesicle. We will call it as the optic vesicle, and this optic vesicle then comes in contact with the developing surface ectoderm. So see, this is neuroectoderm, and from outside, see this surface ectoderm on the outer side, it is growing from outside inwards, and this optic stalk is going from inside outwards. So at a certain point they meet, and this point where they meet, this surface ectoderm and this neuroectoderm, they come in contact. And then the process of development is taken forward. Now, how this process of development is taken forward? See, have a look at these images. They'll just help you a little bit. So you can see this is the neuroectodermal tissue, which is the optic stalk, and you can see the developing surface ectoderm from the outer side. This is your surface ectoderm, and this part of where the neuroectoderm and the surface ectoderm are coming in close contact. Now, this part is called as your lens placode. So this lens placode, you can understand it is going to give origin to the lens. So it's a part of the surface ectoderm. Now gradually this lens placode starts invaginating, and the shape of this optic vesicle changes like this. It now becomes like a cup, and it is called as the optic cup. And at the same time, this lens placode, what happens is that it gets detached from the rest of the surface ectoderm. So see, this is your neuroectodermal tissue. This is now called as the lens vesicle. So this lens vesicle is actually a detached part of the surface ectoderm, and the rest of the surface ectoderm remains outside only like this. So the rest of the surface ectoderm is outside, and a small part of it has got detached and it comes inside this optic vesicle. Okay, then essentially what happens is, I'll just draw a simple picture to make this process a little clearer to you. So I'll try to draw the different layers in different colors. So see, this is your optic vesicle, suppose. This is your optic cup, which is neuroectoderm. So I'll just write neuroectoderm here. So this that I have drawn in black, this is neuroectoderm. Now see this part, this is your lens vesicle, which is surface ectoderm, and the rest of the surface ectoderm is here. So this is the rest of the surface ectoderm. Now at this time, what happens is, a specialized tissue called the neural crest cells, they come and they get deposited in this region. So you can understand the structures in this area, they are formed by your neural crest cells. And at the same time, this outer part, it gets covered by another germ layer. And what is this germ layer? This is your mesoderm. So I have just drawn it in different colors so that it becomes a little easy to visualize. So see, the black that I have drawn, that is your neuroectodermal tissue, which is forming the optic cup. Then see, the lens vesicle is lying inside that optic cup, and the rest of the surface ectoderm is outside, that I have depicted in blue. Then the specialized cells called as neural crest cells are deposited in this area, and this I have shown you in green. And the mesoderm, which I have shown here in yellow, this is your mesoderm, which is outside. So essentially, as I told you, what is the question that we expect from here? The question that we expect from here is, we expect what are the structures originating from neuroectoderm, what are the structures which originate from the surface ectoderm, the mesoderm, etc. So we have to memorize 4 lists basically. Now just to make this process of memorizing a little easier, what I will do is, see, look at this picture. Now what do you think are the derivatives of the neuroectoderm? Now it's a no-brainer that, see, this structure which is going towards the brain, this obviously is this is your optic nerve. And if you trace this neural tissue forward, what do you think it becomes? It obviously becomes your retina. So the optic nerve and retina are obvious derivatives. Now what other derivatives are there? Now if I trace this retina tissue forwards, it becomes continuous with the epithelium of the ciliary body, the anterior epithelium of the iris. Now these are also derivatives of neuroectoderm. And also the muscles of the iris, that is your sphincter pupillae and dilator pupillae muscles, they are also derivatives of your neuroectoderm. So see, the optic nerve, the retina traced forwards becomes continuous with the epithelium of the ciliary body and the anterior epithelium of the iris. Then I told you the muscles of the iris. Now this for some reason is very favorite with examiners and often asked. Where do the muscles of the iris originate from? So they are derivatives of the neuroectoderm. And also the vitreous is also partly derived from your neuroectoderm. So see, these are the derivatives of neuroectoderm. Now if I ask you what are the derivatives of surface ectoderm, again let's go back to this image. What do you think is the most obvious derivative? Obviously the lens, which we are seeing here, and the rest of the surface ectoderm is in front. So what are the structures in front do you think it will form? It obviously forms the epithelium of the cornea and the conjunctiva, which are the structures which are most anterior, and it also forms the eyelids. So the main derivatives of your surface ectoderm are these. Mainly, as we learned, the lens, the epithelium of the cornea and conjunctiva, the eyelids, and the lacrimal apparatus. So the lens, the anterior most structures, that is the epithelium of cornea conjunctiva, then the eyelids and the lacrimal apparatus. Okay, now let's look at the mesoderm. What do you think is the derivative of the mesoderm? Again, let's look at this. This yellow thing that I have shown here is your mesoderm. So you can understand it is the outermost layer. So what is the outermost layer? It's obviously the sclera. So the sclera originates from the mesoderm, and everything outside, that is the extraocular muscles, the orbital soft tissues, they also originate from your mesoderm. So if you are asked what is the most important derivative of our mesoderm, it is the sclera, then the extraocular muscles and the orbital soft tissues. Now whatever is left, so we have learned 3 lists, whatever doesn't feature in this list, we can safely mark it as a derivative of neural crest. Now still, let's just have a look at this image and try to think what are the structures originating from the neural crest cells. So see this green area, that is your neural crest. So see, what are the structures do you think it forms? See, the outermost layer of the cornea that has been formed by the surface ectoderm, but the rest of the layers are left. So that is formed by neural crest. Then you can see that here the angle of the anterior chamber, that is formed by your neural crest cells. Then the stroma of the iris, the ciliary body and the choroid. See, the epithelium has already been formed, but the rest of the iris and the ciliary body is left, that is the stroma. That is formed by your neural crest. So all the layers of the cornea excepting the epithelium, then the angle of the anterior chamber, the stroma of the iris and the ciliary body. These are the derivatives of your neural crest. So let me just repeat it once more. What are the structures originating from the neural crest cells? So structures originating from the neural crest cells are all the layers of the cornea excepting the epithelium, then the angle of the anterior chamber, the stroma of the iris and the ciliary body, and the whole of the choroid. These are the derivatives of the neural crest cells. Okay, so this is about the developmental anatomy that you need to know. So essentially you don't need to know the entire process of development. I think if you just remember this diagram that we have just drawn with these colors, I usually depict it in these colors for a visual impression. If you remember this, the important structures which are derived from each of the germ layers, you will be able to see. Okay, so this is the basic ocular embryology that you need to know for any exam. Now another thing which I thought that I'll just cover are the developmental anomalies. These are also have not been discussed in too many details anywhere, but at the same time I think given the nature of the image based questions and the clinical questions that we are likely to get and we are already getting, we should know a little bit about the developmental anomaly. So I'll just try to discuss it more in terms of images. So if there is a problem in the development, you essentially have a set of disorders which are called as anterior segment dysgenesis disorders. So this anterior segment dysgenesis is mainly because of a problem in the migration of the specialized cells, which I told you are the neural crest cells. So many of them are also called as your neurocrystopathies. So you can understand from the name why they are called as neurocrystopathies, because there is some problem in the migration of the neural crest cells. So these are your anterior segment dysgenesis, the anomalies which come under anterior segment dysgenesis, mainly associated with the migration of the neural crest. So just to quickly revise, what do we remember about the derivatives of neural crest? Remember, it gives origin to all the layers of cornea except the epithelium. It gives origin to the angle of the anterior chamber, then the stroma of the iris and the ciliary body, and the whole of the choroid. So all the layers of cornea except the epithelium, then the angle of the anterior chamber, the stroma of the iris and ciliary body, and the choroid. So essentially, most of these anterior segment dysgenesis syndrome, the posterior part of the cornea, the angle of the anterior chamber and the iris stroma, they are affected. And if the angle of the anterior chamber is affected, you understand that the patient may also end up with glaucoma. Okay, because we learned that the aqueous humor is flowing out through the angle of the anterior chamber. So in most of these anterior segment dysgenesis diseases, you will, or syndromes, you will notice that there will be disorders in the posterior layers of the cornea, there will be disorder in the iris, and also there will be disorders in the angle of the anterior chamber, essentially manifesting as glaucoma. So I'll just go over the disorders and a few important clinical photographs. So see, there is something which is called as posterior embryotoxon, which is an anteriorly displaced and thickened Schwalbe's line. Now, what is the Schwalbe's line? The Schwalbe's line is the end point of the Descemet's membrane of the cornea. So the Descemet's membrane is one of the layers of the cornea, and the point where it ends is called as your Schwalbe's line. So because the posterior layers of the cornea are formed from these neural crest cells, here we have a very anteriorly displaced and thickened Schwalbe's line, which looks like this, a greyish white line which is concentric anterior to the limbus. And it is inherited as an autosomal dominant disorder, and many of these patients are at a risk of glaucoma because see, if it involves the Schwalbe's line, there is a good chance it can also involve the angle. So this can come as an image. So you see this kind of a whitish, greyish white line, concentric and anterior to the limbus. This is a posterior embryotoxon, inherited as an autosomal dominant trait, and often the patient has a risk of glaucoma. One of the anterior segment dysgenesis disorders. Next, there is something more, I would say something with more features, and that is the next one, that is called as Axenfeld-Rieger syndrome. Now, this is actually a spectrum of ocular and systemic anomalies where there is a posterior embryotoxon. So, see, the posterior part of the cornea is involved. At the same time, there are peripheral iris strands. So, the stroma of the iris is also involved in this. And you have many disorders in the iris like iris atrophy, polychoria. So, what is polychoria? This is polychoria. Polychoria means what? Multiple pupil. So there are multiple pupil or polychoria, and there is chorectopia. Chorectopia means abnormal position of the pupil. So chorectopia or abnormal position of the pupil, polychoria or multiple pupil, and patches of iris atrophy with iris strand. So you can understand here, apart from the posterior part of the cornea, the iris is also getting involved. And of course, if these two are involved, what is connecting, that's the angle, that also is likely to be involved, and these patients also have a risk of glaucoma. So this is Axenfeld-Rieger syndrome. So here also basic features I think you should know, and if you get this image, you should be able to identify this. So we started with posterior embryotoxon, which was like very simple, and then we moved to a spectrum which is more complex, and that is this. Okay, next, what other anterior segment dysgenesis syndromes do we have? We have something called as Peters anomaly. Now here there is a corneal opacity because of the involvement of the posterior part of the cornea. So the posterior, here also it is the neural crest cells which is defective probably, and the posterior part of the cornea is opaque, giving rise to a corneal opacity like this. And there is also involvement of the angle giving rise to glaucoma. These are the two essential features. Corneal opacity due to involvement of posterior part of the cornea, and glaucoma due to involvement of the angle. Now Peters is again divided into type 1 and type 2 depending on whether they are iridocorneal adhesions or there are both the iris and the lens are attached to the posterior corneal surface. So if only the cornea and the iris are attached to each other, we will call it as type 1 Peters, and if both the iris and the lens are attached to the posterior corneal surface, we will call it as type 2 Peters. So essentially we must have a corneal opacity and we will have a glaucoma. Apart from this, depending on whether it is type 1, you will have iridocorneal adhesions, or you will have both iris and lens attached to the cornea in type 2 Peters. So this is another third variety of anterior segment dysgenesis. What else can we have? We can have aniridia, which is a complete absence of the iris. So the iris is just like completely absent, and this is associated with a deficiency of limbal stem cells. So I told you the limbus is the storehouse of the stem cells that are responsible for regeneration and repair of the ocular surface. So this absence of the iris, that is aniridia, has got this strong association. So this is also something I think can come in the exam. So remember this, aniridia with limbal stem cell deficiency is also one of the developmental anomalies. Then you have a very important disorder, that is primary congenital glaucoma. So congenital glaucoma, which is caused by malformation or maldevelopment of the trabecular meshwork in the angle. So that's called as trabeculodysgenesis. So see, once again I told you the angle is formed by the neural crest cells. So if there is a problem with the neural crest cells, the angle may be involved and you can get maldevelopment of the trabecular meshwork, giving rise to primary congenital glaucoma. Right? Then you can have something which is called as sclerocornea. Now sclerocornea means that the sclera and the cornea, the sclera is supposed to be opaque, but the cornea is also opaque like the sclera. So this is what a sclerocornea looks like. This is also because of the disorder of in the formation of the anterior segment. So this also comes under the anterior segment dysgenesis syndromes. Then you have something which is called as congenital hereditary endothelial dystrophy, where the endothelium, that is the posterior part of the cornea, is defective and the child is born with bilateral hazy cornea due to corneal edema. So these are mainly the disorders of the anterior segment due to developmental anomaly. So let us look at this just quickly once more. So we discussed posterior embryotoxon, we discussed Axenfeld rigor, then Peters anomaly, aniridia or absence of iris, primary congenital glaucoma due to trabeculodysgenesis, sclerocornea where the sclera and the cornea are both opaque, that is the cornea is opaque like the sclera, and congenital hereditary endothelial dystrophy where the endothelium of the cornea is defective and the cornea is bilaterally hazy due to corneal edema. Okay, so these are the disorders of the anterior segment. Now let us look at another set of disorders which are also because of developmental problem, and that is this. That's called as coloboma. Now what is coloboma? Now here see, when we learned the development of the eye, I'll just go back to this picture once more. We learned that this lens vesicle, remember, it lies at the center of your optic cup. See, the lens vesicle is at the center of the optic cup. So you have the optic cup, which is something like this. And here, surrounding it, here you have the lens vesicle. Right, but actually this optic vesicle, I'll just draw it a little better. So see, this optic vesicle is actually not covering the lens vesicle. The optic cup is not covering the lens vesicle totally. There is a small area which is deficient, and this is called as your choroidal fissure, or it is called as your embryonic fissure. We can call it the choroidal fissure. It is also called as your embryonic fissure. Now, why do we need to have this embryonic fissure? This is meant to allow the entry of the hyaloid system of blood vessels, which provides nutrition to the developing eyeball. So this optic cup that you have, which surrounds this lens vesicle, is not complete. It's actually deficient because of this embryonic fissure to allow the access of your hyaloid system of vessels. Now this embryonic fissure, it is supposed to close over a period of time, and the hyaloid system of blood vessels will disappear. Now, if there is a developmental problem and this embryonic fissure fails to close, then that is called as a coloboma. So what is a coloboma? Have a look at this picture. See, there is this optic cup and you can see this fissure or this embryonic fissure, and through this embryonic fissure you can see the hyaloid system of blood vessels which is entering inside. So this is your fissure, this area. As I told you, this fissure should close. Now if it doesn't close, then that area will remain deficient, and that area typically is inferonasal. So the position of that fissure is inferonasal. So inferonasally, that part will remain deficient, and that is called as coloboma. So it is caused by an incomplete closure of this embryonic or choroidal fissure, and as I told you, it is typically located in the inferonasal quadrant. And when that tissue fails to close, then everything on that line also remains deficient. So see, this optic cup is actually neuroectodermal tissue, but when this neuroectodermal tissue doesn't close, all the other tissues, that is the neural crest cells, the mesoderm, all those tissues on that line, they kind of remain deficient. So that area shows a deficiency, and that is called as coloboma, typically in the inferonasal quadrant. So see, the commonest is this, the iris coloboma. So see, in the inferonasal part, this iris is deficient. This is called as iris coloboma or keyhole pupil, and very often it is not just an iris coloboma, all the structures on that line are deficient. So you can have a lens coloboma, you can have, see, this is the chorioretinal coloboma. That is, the choroid and the retinal tissue on the same line are also not properly formed, they are deficient. And you can also have an optic nerve coloboma. So because the choroidal fissure or the embryonic fissure did not close, so all the tissues on that particular line remain sort of underdeveloped or deficient, and that's called as coloboma. So the commonest is keyhole pupil, that is your iris coloboma, which is this one, the keyhole pupil. And on the same lines, you can have chorioretinal coloboma, you can have lens coloboma, you can also have optic nerve coloboma. So this is coloboma. This is also this is a common developmental anomaly that we get to see in practice. Right, so we discussed the anterior segment dysgenesis, we discussed the coloboma also. Now another uncommon disorder, but something which is asked in exam because it is got a unique name and a unique appearance, and that is called as a morning glory disc. Now this morning glory disc is an anomaly where you have a funnel shaped excavation of the optic disc. So this optic disc, the central part of it, it has got an excavation and there is a glial tissue at the center. So you see this area that you see, this is the glial tissue. And from that you can see the blood vessels which are emanating like this radially. So normally you know what the optic disc looks like. The optic disc looks like this. This is how the blood vessels come out. But here see, the blood vessels are radiating out radially like this. Right? So this can come as an image based question. So the blood vessels radiate out like this in a radial fashion. It is unilateral. It is a developmental anomaly of the posterior segment, mainly the optic nerve, and it is often associated with glaucoma also. So it is unilateral. It may be associated with glaucoma. There is a funnel shaped excavation of the optic disc and there is a central tuft of glial tissue. These are the important points you have to remember about the morning glory disc. So these two things in the posterior segment. So anterior segment, we learned about many anterior segment dysgenesis disorders. In the posterior segment, mainly the chorioretinal coloboma and the morning glory disc. Now the last part of this developmental anomaly are the embryonic remnants. What do we mean by embryonic remnants? Meaning structures which should have actually disappeared, but if they still remain, they are called as embryonic remnants. Now I told you that through the choroidal fissure, the hyaloid system of blood vessels enter inside the eye to provide nutrition, and over a period of time they are supposed to disappear. But if this hyaloid system of blood vessels, they remain, then you can have these embryonic remnants, that is the Mittendorf's dot and the Bergmeister papilla. So the Mittendorf dots is when the anterior end of the hyaloid artery remains and it is attached to the posterior surface of the lens. So this is the lens, the anterior part of the hyaloid artery remains attached to the posterior surface of the lens, that is called as Mittendorf's dot. And there is also something called as Bergmeister papilla, which happens when the posterior end of the hyaloid artery remains attached to the optic disc. So if the front part remains attached to the lens, posterior surface of the lens, that is called as Mittendorf's dot. And if the posterior part of the hyaloid vasculature remains attached to the optic disc, that is called as your Bergmeister papilla. So these can also come as small clinical questions. So this is about the developmental anomalies. So as I told you, development and ocular embryology has not been asked in very much detail, but I have tried to cover almost everything that I feel that you should know before appearing the exam. So as I told you, from embryology, we have to learn what are the germ layers, what are the derivatives of each of the germ layers, and the basic developmental anomalies with their critical features, and the images. Do have a look through the images, because given the nature of the questions, there is a likelihood that we can get clinical or image based questions from this section.